Broadcasting from Silicon Valley, California, this is Conversations with Jennylyn.
You are watching Conversations with Jennylyn, and as I continue my COVID-19 World Interview Series, I am bringing you another fascinating woman, Dr. Christine Richards. And Christine works at the St. George's Medical University in Grenada. Christine, thank you for coming to my show.
Thank you, Jennylyn. It's a pleasure. I've watched so many of your shows. I enjoy looking at them, and I know that you're doing a great job. And I think at this time with COVID-19, it's a good series of interviews to do, at least, for your audience. So you keep giving them information. I guess that's your purpose.
Thank you. Yes. And then I can speak with someone like you at your home, and you can share with us from a perspective of non-sensation or any type of hype, just plain and straight as it's happening. And that's what I'm trying to do here, is just bring stories from people within different countries and professions, just to share their experiences and what they're observing that's taking place around them during this time of crisis. So tell us about your university where you work.
Okay, so I'm, as Jennylyn introduced, I'm Dr. Christine Richards. I work at the St. George's University in Grenada. The university houses a number of departments. There's a School of Medicine, there's a public health program, there's an undergrad school. We also have some other graduate programs. Many of the students at the university are from the United States. We have students actually from all over the world, but 95% of them are from the US. So I work in the public health department at the School of Medicine. And our students are mainly, again, students from the US. So much of our students are actually medical students who are doing both an MD degree and an MPH degree.
That is great. So how long have you been working at the university?
16 years. So I've been there for 16 years.
That's wonderful. So you work at the university for 16 years and you were in the public health department.
That's correct.
So you were very busy during this time of coronavirus.
Well, at this time I'm on vacation. I happen to be on vacation at this time. However, when the outbreak started, of course, I was working. When we had our first case in Grenada, we were still working in the department. So we did reach out to the government to see ways in which we could help. They did invite us to a few meetings. The university itself, the administration, has been helping the government. They've provided them with supplies, they've provided them with resources, they've provided them with their labs so that they can use those for testing. So the university has done quite a bit to help the government at this time.
And so unfortunately, you told me all this before and we didn't record the show. So I have to ask you this again. How many students you have at the university and where are they now? Or have they left?
So right now we have on campus just under 100 students. So before that, we had over 3,000 students or more on campus. But when the outbreak started, just before we got our first case in Grenada, the university, I think, took a decision, which I think was a brilliant decision, to get the students home. So as I mentioned before, 95% of our students are from the US. And because Grenada is a developing country, not many resources, it was felt that if there was an outbreak here in Grenada, the health system would not be able to sort of facilitate or provide services for large numbers of persons. And with over 3,000 students here, it meant that the government would not have had enough resources to provide for them as well as their citizens. So the university made a decision to send the students home. So they invited the students to go home. They provided charter flights. Almost 20 charter flights were provided for students to go home. Most of the students accepted that opportunity and they left. Some of them stayed back. And then later on were given another opportunity again to leave. So most of them have left. So right now on campus, I think we have some students who were not able to go home. So the few students we have from China, I think, and we have some from India, but were not able to go home because their countries have locked down the airports. So they stayed back. So we have just a few students on campus.
Oh, that's great. And so to date, how many cases of corona patients do you have? And how many people have died from the disease that you know of?
Right, so currently, based on information shared, I think 2 days ago by the government, we have 14 cases. 14 persons have tested positive. Of those 14, 13 are here. There are no deaths. One person left the island. They were supposed to be under isolation or at home. They're supposed to be isolating themselves, and they left without the government's knowledge. So the government has since sort of examined their system because they realized that, you know, there are gaps in the system that they needed to fix. So they've done that, and I'm hoping that those gaps have been fixed so that we won't have any, you know, such occurrences again.
Well, your airports are closed, right? So nobody can leave even if they want to.
That's right. So right now the airports are closed. The only air traffic coming in are those with cargo or medical supplies, but you know, no passenger flights are coming in.
Yes, that person who left was very selfish because they got on an airplane with a lot of other people knowing that they had the virus. And so all the passengers in that airplane were subjected to possibly picking it up. That's really sad that people can be that selfish.
That's true.
So how is your government controlling the spread of this disease, and how are they keeping it from turning into a New York, for example, where you end up with so many fatalities?
Well, first of all, let me say that it's important that they keep the numbers down because for one, they don't have resources. And they're not, even in New York, even in the US, they're struggling with all of the resources they have. They're struggling to sort of work with those persons who are sick. You know, they're still having so many deaths, persons still are not being tested, they don't have enough ventilators. So even in the US, they have challenges. Grenada is a developing country. Very limited resources. They're relying on help from elsewhere. So they've gotten some help. The university has provided quite a bit of help in terms of ventilators, in terms of labs for them to do testing, in terms of consultations, you know, with experts and so on. But in addition to the university, Venezuela has provided some help. They got some stuff from Venezuela.
Wait, I thought their economy was in trouble and they still can help. That's great.
It is great that they were able to send some testing kits and so on. Cuba, they got some help with doctors. Some of the doctors came over to help from Cuba. China, they also got equipment from China. So they're relying on other countries for help. Right now, because the US has its own challenges, of course, they can't rely on the US to send anything down here because they themselves need all of the equipment. So the government, in addition to getting all of that help, made some decisions to sort of control the spread. Our first case was an important case, so was our second and third cases. They were all imported, initially from the UK, and then we had a case, I think it was from New York, somewhere in the US. And through those cases, other persons like relatives and so on got infected. So what the government has done is to, in the first instance, impose a lockdown. The first lockdown was for hours between 6 in the evening to 5 in the morning, you know, advising people to stay home. Persons were not listening, so then they changed that and they imposed more severe what I would call a more severe lockdown. And I think, you know, the idea behind the lockdown was good because their thinking was that if we lock down for 2 weeks, if we do have persons who are positive, within that 2-week time, they should start showing some symptoms and come forward to get tested. And then if we're on lockdown, it means therefore that those persons are not able to be mixing, you know, with other community members to spread. So their idea is a good one with this lockdown. But there are some challenges that have resulted because of the lockdown. A lockdown means that everything is closed. All the banks are closed, supermarkets are closed, only essential workers are out. So all day you're at home, you know, students are doing their classes online, people are working from home. So when they eventually decided to open the supermarket, because people need to get goods, they have to get food, the supermarket lines were really long. People stayed, you know, all day in the line. I was not able to get any food. So they realized that they had created some challenges. And of course, the population was disgruntled because you're not able to get food. So they changed that. They said, okay, this is not working so well. We need to fix it. So they came up with a second strategy. So they decided to split the population by last names. So if your last name is from, you know, A to, I think it was K or L, A to L or something like that, then your supermarket hours was Saturday morning and Sunday afternoon. So they only opened up the supermarket on the weekend. And then if your last name started with M or to Z, then your supermarket hours were Saturday afternoon and Sunday morning. So even with that, they tried that this weekend. And yesterday it was a mess.
So when you have that, then you have to practice social distancing. So these lines must be humongous.
Right, because people have to stand 6 feet apart. So
are people really vigilant and listening and following those rules? Do you think, have you noticed that people are following it and keeping?
Well, some people are, at least for the supermarket lines, they are. You know, they have to. So they've been following it in the supermarket lines. In some villages, you still see people hanging out and so on. It's difficult to get individuals to change behavior. I mean, you can tell them, you know, but to enforce it and for people themselves to do it, it becomes a challenge.
Well, it's interesting though that considering you haven't had any deaths, I think that's amazing that you haven't had any deaths. Do you think that the temperature, like they say, and the BCG shot, do you think this is playing a part in some people's resilience and the numbers being so low in Grenada?
Well, I'm not sure why there haven't been any deaths or why the numbers are so
Thank
low.
God.
Yes, so we're happy that there have been no deaths, but in terms of the BCG vaccines and the other things that are out there, or temperature, I mean, none of that has been proven, so we don't really know.
Right.
As you know, COVID-19 it's unprecedented, it's unpredictable. You know, different persons seem to be experiencing it differently. Some persons are having mild symptoms, some persons are having more severe symptoms. So it's difficult to say, you know, to give a reason for that.
But so when your vacation is up, you are going to resume your habit of teaching, because yours was not your habit, but your curriculum, which was online. Mm-hmm. So basically, you don't really have any major adjustments except you're not physically going to the university.
Right. So right now, the university itself is on lockdown. So everyone is working from home. So when we resume in May, we will most likely be continuing to work from home, doing our classes online. We will continue to do that. Yes.
What have you found the most challenging since this outbreak?
Not being able to go out. I think that's the most challenging thing, being at home all day. I mean, we're lucky in these parts of the world, at least we have a yard and the temperature, the weather is really good. So we can at least go out in our yard and walk around. So we get out every afternoon or during the day and we just walk around in the yard, we walk up and down. I think the most challenging piece is not being able to go out. We understand the reason for that, so we're not complaining. It's just something that we're gonna have to get used to. And I'm just guessing that the new norm, it's, in the future, things are gonna change. People's behavior will change because of COVID-19. We will continue to practice the frequent hand washing, the sanitizing. That's just going to become part of what we do. And maybe even the social distancing, no more handshaking, no more hugging. So those things will become a new norm because we don't know what to expect next year. Is there going to be another flu? Every year there is a flu during flu season. So what is that going to be like? Nobody really knows. So things are going to change and there's going to be a new norm. People will continue to suffer from psychological distress. As I mentioned to my husband, he's going to have a lot of work to do because people are scared. There's fear of death, fear of illness, fear of getting infected, of spreading it, of stigma.
Well,
it's scary.
My viewers don't know what your husband does, so maybe you should tell them why he's going to be busy.
So he's a psychiatrist.
He's a psychiatrist at the university, right?
Yes, that's correct.
So
all the psychologists and psychiatrists are going to have work to do.
So as the psychiatrist at the university, have you seen his volume of work increase since the virus has infected your island?
Well, his clients are not here, which are mainly students. The students have left.
Oh, okay.
In terms of the local population, he has had a few. He's not practicing because of the social distancing. So much of what he's been doing is via telephone.
Mm-hmm.
Yes.
And so when, have you noticed, because I know you've had no deaths and you've had 14 or 15 cases, has that plateaued?
Well, we don't know.
Oh, that was just your numbers. Those are numbers today.
Yes, those are numbers to date. So the last press conference that was held, that's the number that was given. So we're hoping that even if it increases, it wouldn't be by much.
How have you seen the island affected apart from this, from the lockdown? What has been the one thing that's been visibly, that's been noticeable apart from the streets being clear? Has anything else, I guess what I'm asking is, what have you learned from this experience so far?
Okay. That life can change rather quickly. That one virus can just bring everything to a standstill, and it has done that globally. It just changed everything so quickly. All right,
Yeah.
Nobody was ever expecting that this is, gonna happen. So things just change rather quickly.
And we are more adaptable than we think, right?
We have to. Sometimes you don't have a choice. There's no choice. You have to adapt.
And do you feel like the hospitals in Grenada are equipped to handle, if you have a lot more cases? Because it sounds like you got help from quite a few countries.
Well, Grenada, they were able to get some equipment from other places. I don't know how many ventilators and so on they have. The minister says that they have some ventilators, they have medication. I don't know for how many persons they'll be able to treat with that, but they do have some.
And the rest of the students that attend the university, not the ones in your department, because your department, they work online anyway. How do you see the other departments, how do you see their curriculum being affected by this online situation, if at all?
Well, they have also gone online, and it's not only unique to St. George's University, because I think a number of universities in the US have done the same thing. So they have also gone online. Instructors were forced to learn, ways to teach online. You have to become quite creative if you're teaching online because it's different. So, and to put everything online quickly was a challenge. So having small groups online, teaching persons how to use the Zoom platform, using Zoom for small groups, having students logging in from all over the world, you know, and having an instructor there. It was a different experience for many, and I'm sure a learning experience and hopefully a positive one for many persons, because online education is really growing. So I think this is not going to change. My guess is that in the future, we may have more of these online sessions. Even at the med school level, whatever can be done online, may be done online. It may change the way medical education is offered.
I think education in general, I'm sure that a lot of people might actually become comfortable with this and not.
It's not, you see, if you're used to classroom-based teaching, I remember having to switch from classroom-based teaching to online teaching, and I did not enjoy it at all. I did not like it. I missed having that interaction with my students. I missed knowing who my students were, because while students are required to sign in for classes live and put on their cameras and so on, sometimes you have so many of them that you don't really become familiar with your students. It's a challenge. So as an online educator, you really have to get creative if you were to enjoy it and have your students enjoy it.
I know that the economy around the world is going to take a hard hit from this. Do you feel that your economy is going to be hit very hard? I know it will take a hit, but do you think it will have this virus will have a devastating blow to the Grenadian economy?
Definitely a hit. The Prime Minister has already spoken about that, and that is happening globally. We depend on tourism, and then much of the economy here, the medical school contributes to, because all those students who come in here, they rent apartments, they rent cars, they purchase from the supermarket. So all of that is affecting the economy, and it's going to take a major hit.
Is the government going to assist some of the families? Like in the US, they're going to send checks to some families whose income you had to go to work to earn. In similar situations, does the Grenadian government have programs in place to help those people that you know of?
Yes, they have. So the Prime Minister also announced that, was it last week or this week? So they will. I think they were able to get some money. The government was able to get some money to borrow, so they're going to be helping out their citizens.
IMF? The International Monetary Fund is going to get drained from this experience by the time it's over. So before we wrap up, because I know we had to do this twice, and for my viewers, we did a great interview earlier, and for some reason, the camera was on, the recorder was on pause, and it was not recorded. So this is a second retake, and I'm so upset because the first one, she did an equally great show, but hopefully we didn't miss anything pertinent. So Christine, before we wrap up, what would you like to leave with the viewers?
Well, that all countries are experiencing challenges during this time. There are no sort of major lessons, or I guess there are some lessons that can be learned from countries, but one size doesn't fit all, which means that one intervention that may have worked in Wuhan is not necessarily going to work in Grenada or St. Vincent or Guyana. There are too many variables. We've seen that it's difficult to get individuals to change their behavior. And a reason for that is because we don't facilitate, the environment does not sort of facilitate their behavior change. There are issues with socioeconomic status, there are cultural issues. People are used to behaving in a particular way. People are forced to go to work because they have to pay their bills. How do you ask someone to stay home when they have to go to work? They still have to pay their rent, they have to purchase food. So there are all of these challenges that our individuals are experiencing. And while we can sit back and say, you know, people are being advised to stay home or to practice social distancing and they're not listening, we, I guess, don't really understand what's happening in those individuals' lives, why they're not practicing social distancing or they're not going to work. How do you do that if you live in a crowded area? You have to take a train, you have to take a bus, you live in a small apartment. Those are all challenges that people are experiencing. So one size does not fit all. This COVID-19 it's unpredictable. It's scary. The uncertainty is what makes it scary. No one knows what to expect. So I guess we have to continue to try, different strategies. Countries will have to learn from their experiences and just keep trying to see how best they can protect their populations.
Well, I agree with you. But the one good thing, even though it's not a cookie cutter way of dealing with this disease, like you say, it's unique. What you do is unique to your country. I still think that one of the great things about doing these interviews is when people share what's happening in their country with me. Maybe people watching can learn something from what you're doing in Grenada that could benefit me here in California, or someone in India or China or wherever. So I think it's great that, we share these ideas or these practices that we're doing during this time, and hopefully something that's working for someone else might be, you can apply and in your situation, and it can help you. So
what definitely works though for some, we need to continue practicing the hand washing, keeping your hands away from your face, sanitizing, social distancing. Those things are really important in, protecting persons. So if every individual can do that, I think at least it should make a difference in the number of cases and number of infections and number.
Why weren't we doing that before? Why did we need a virus to come and attack us for us to wash our hands? That just blows my mind that people weren't washing their hands. It really makes you wonder, how could you, why is this new? I heard somebody saying, oh, now I wash my hands so much it's getting chapped. I never used to wash my hands. Really? So anyway, there's so many lessons in this experience for all of us, I think. And hopefully people are paying attention and learning them. So Christine, I'm so grateful that you didn't only do one interview with me, you did 2 in 1 sitting. And hopefully we captured the essence of what you told me the first time, the second time around. And I hope that Grenada continues to keep their numbers down in terms of contamination, and that at the end of this whole experience, you wouldn't have any deaths. And I hope that you stay safe, and I wish you good luck with your new curriculum starting in May. Do you think school will stay on lockdown throughout the year?
Well, you're talking about the primary and secondary schools, or?
Thinking about the university where you work.
It will. Well, students are currently doing their classes online. I think the next time they should be back here is sometime in August. We have one term that should be returning in May, and I'm not sure if they'll return in May. But after that, the others should be coming back in August, and I'm not sure, whether that will happen or not, or whether it will continue online.
So you think your airports are going to remain closed through May?
That question I cannot answer. I don't know.
That's optimistic. But I hope it can. The problem is, even if you manage to stabilize your situation in Grenada, when you open up your airports, who knows what you're going to be reimbursed.
So that's a challenge. Those are, things that I guess the government has to think about.
Right.
Yeah.
Well, again, thank you for your time, and hopefully this interview somebody watching will learn something from it. Keep up the good work, Dr. Richards. I'm very proud of you, my sister. And I hope that the situation in Grenada stabilizes, and that pretty soon you can return back to normal, even if your airports are not open.
Well, thank you for having me and for giving me the opportunity to speak about Grenada and about what's happening here.
It's great because a lot of people don't know much about these islands, and so I love that you share so much about the island, and I don't know if we captured in the second interview as much as you shared in the first one, which is a shame, but Grenada is a very beautiful island in the Caribbean, and it's known as the Spice Island, right?
That's correct. Tri-island state, Spice Island, very beautiful island. Small population, just over 100,000.
So continue to stay spicy and safe. And I thank you for watching Conversations with Jennylyn, when a conversation is all you need to be inspired.
Broadcasting from Silicon Valley, California, this is Conversations with Jennylyn.